Have you ever felt something strange in the middle of the night? A brief moment when your body didn't feel quite like your own, but you brushed it off as nothing? One of my patients once shared a story that still stays with me. She told me she had gone to bed feeling completely fine, yet when morning came, her hand felt weaker, her words felt slower, and her mind felt cloudy. She convinced herself it was just age or a bad night of sleep. I want you to imagine this for a moment. You wake up in the quiet early hours, expecting to feel refreshed, but instead you sense something is off, something your body has been trying to whisper to you while you slept. Nighttime is supposed to be the body's sanctuary. It is the time when your heart rate slows, your breathing deepens, and your cells repair themselves. Yet for many older adults, it becomes one of the most vulnerable periods. A large number of strokes in seniors happen between midnight and early morning, often silently, without the dramatic warning signs we tend to picture. As someone who has spent decades caring for older adults, I've seen how those early clues can be so subtle that they blend into the background of everyday life. The truth is that the body whispers before it ever shouts. When blood pressure dips during sleep and the arteries have become stiff with age, the brain may struggle to receive the steady flow of blood it needs. In people with undiagnosed atrial fibrillation or nighttime breathing issues, tiny clots can form or oxygen levels can fluctuate without them realizing it. By the time morning comes, the signs are there, but they are often disguised as simple fatigue or the natural slowing that comes with age. Tonight's video will help you recognize those hidden signs, understand the dangerous patterns, and learn the practical steps that keep you safe. If this message resonates with you, please subscribe, like, and share the Senior Health Daily channel so we can continue supporting our community. Understanding these silent clues could save your life or the life of someone you love. In the next part, we will explore the overlooked nighttime warning signs you should never ignore. Why strokes often happen at night.
Action!
Nighttime has always fascinated me because it is when the body finally lets go. The heart rate slows, the muscles release tension, and the mind drifts into a rhythm that feels almost like gentle waves brushing against the shore. For most people, sleep is the body's natural reset button. But for many older adults, especially those with underlying conditions they may not even be aware of, this quiet and peaceful time becomes a vulnerable period. I have cared for seniors who enjoyed perfectly normal evenings before suddenly waking up with symptoms they never expected. When you drift into sleep, your circulation naturally slows. This is not a problem for a healthy young body, but for someone with stiff arteries, blocked vessels, or reduced cardiovascular resilience. The decrease in blood flow can become dangerous. The brain relies on a steady supply of oxygen and nutrients, and when those vessels are narrowed or weakened, even a small drop in circulation can create a window for a clot to lodge itself or a vessel to struggle under pressure. Another important factor is the nighttime dip in blood pressure. In younger adults, this is a normal and healthy response. But in seniors, blood pressure may drop too low, a condition known as nocturnal hypotension. When the pressure dips beyond the brain's comfort zone, blood flow becomes unstable, and certain areas of the brain may not receive the oxygen they need. The opposite can also happen. Some people, especially those who carry stress into their sleep, experience a sharp spike in blood pressure during the early morning hours, known as the morning surge. This sudden rise can cause fragile arteries to rupture or push a clot further into the brain's delicate network. Sleep apnea complicates everything even more. When someone repeatedly stops breathing during the night, oxygen levels fall with each episode. Most people have no idea this is happening because they never fully wake up. Over years of practice, I have seen seniors come into my office complaining of fatigue, forgetfulness, or morning headaches, unaware that their brain had been fighting for oxygen every night for years. These dips in oxygen create tiny micro-injuries in the brain, and inflammation builds slowly until one night, a major stroke occurs. Many stroke patients I've cared for had beautiful, calm evenings before everything changed. They watched television, read a book, or spoke with family, never imagining that the critical moment would happen while they slept. This unpredictability is what makes nighttime stroke symptoms especially important to recognize. Silent warning signs that happen while you sleep, silent symptoms during the night, can be easy to miss because they do not always wake you fully. They appear as subtle disturbances, quiet discomforts, or quick sensations that seniors often brush aside. But these moments matter. They are the body's whispers. One of the most overlooked signs is a sudden nighttime headache. Many older adults chalk it up to a long day, dehydration, or stress. But a headache that begins abruptly in the middle of the night can be the brain's way of signaling that blood flow is unstable. Changes in pressure, especially in someone with narrowed arteries, can trigger pain that feels sharper or different than usual. I have met seniors who told me they woke briefly, felt a dull ache around the temples or behind the eyes, then fell back asleep. Hours later, they woke with weakness or numbness they never expected. Another warning sign is numbness or tingling that appears briefly during the night. You might shift positions and blame it on sleeping awkwardly. But when the sensation feels unusual or when one side of the body feels heavier or slower, it could be the brain misfiring because of impaired circulation. The brain communicates through electrical signals, and when blood flow becomes inconsistent, these signals may flicker before failing entirely. Waking up, gasping, or choking is a classic sign of sleep apnea and a major stroke trigger. When breathing stops repeatedly, carbon dioxide rises and oxygen falls, forcing the heart to work harder every night. People often underestimate the long-term impact of this stress. I once treated a man who thought his gasping episodes were simply nightmares. In reality, his oxygen levels were dropping dangerously low, and his brain was struggling to stay protected. He eventually suffered a stroke that left him with lingering memory problems, something that could have been prevented with earlier intervention. Night sweats can also be a quiet warning sign. When the nervous system detects unstable blood pressure or irregular heart rhythms, the body may respond with sudden sweating to reset itself. Seniors often dismiss this as a warm room or a heavy blanket, but if it happens repeatedly or is accompanied by a strange feeling in the chest or head, it may signal something deeper. Another sign many seniors ignore is sudden confusion or vivid disorientation upon waking. I have heard countless patients say they felt foggy or unusually slow in the first minutes after getting up, but assumed it was just part of aging. In some cases, this fogginess reflects a temporary lack of oxygen to key areas of the brain, either during the night or at the moment of waking. Temporary vision changes can be another early flag. Blurriness, double vision, or even partial loss of vision for a few minutes can indicate that the brain's visual centers struggle to receive enough blood flow. These symptoms may vanish quickly, which leads many to ignore them, but disappearing symptoms do not mean disappearing danger. One of the strongest clues that something happened during the night is a weak grip or difficulty lifting objects in the first moments of the morning. If you reach for a glass of water or attempt to open a door and your hand feels weaker than usual, the brain may have experienced an episode during sleep. Over the years, many seniors have told me they felt slow or weaker in the morning, but felt better after a few minutes. They did not realize that the improvement did not erase the fact that something went wrong. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. Subtle changes in the body. The night before a stroke. Some signs appear the night before rather than during sleep. They may feel so normal that they blend into the routine. One of these is shoulder pain or neck stiffness. Many people assume it is caused by posture, stress, or aging. But when the pain is on one side or feels strangely deep, it may be related to blood flow changes or early nerve involvement. Another subtle sign is difficulty swallowing saliva. Seniors often blame dry throat or acid reflux, but when swallowing feels different, or when saliva seems harder to manage, it signals that the brainstem or related neural pathways may be under stress. Unusual fatigue despite resting well is another quiet clue. When the brain is struggling with circulation, the body may feel drained even if sleep seemed adequate. A patient once told me she felt exhausted the night before her stroke, as though she had run a marathon, even though she had spent the entire day relaxing. Her body was warning her long before symptoms became clear. These early signals occur because certain areas of the brain receive less blood than they need. When even a small cluster of cells becomes underperfused, the body begins sending messages, hoping someone will listen. Hidden risk factors. Seniors often overlook nighttime stroke risk increases dramatically when certain hidden factors are present. Irregular heartbeat at night, especially atrial fibrillation, creates the perfect environment for clot formation. The heart does not beat rhythmically enough to move blood smoothly, and tiny clots can form and drift toward the brain while you sleep. Uncontrolled blood sugar causes nighttime spikes and dips that weaken blood vessels over time. Seniors with diabetes often experience fluctuations that disturb the entire cardiovascular system. Many are unaware because they feel no obvious symptoms during the night. Dehydration is another major contributor. Seniors often drink too little water throughout the day and then avoid water in the evening to prevent nighttime bathroom trips. The result is thicker blood circulating through vessels already narrowed by plaque. Sleeping pills and sedatives slow the nervous system, making it harder for the brain to sense danger or regulate breathing properly. While these medications can help with insomnia, they must be used carefully because they can mask critical warning signs. Poor sleep posture can also be surprisingly harmful. When the head is tilted too far, or when neck pressure increases due to positioning, blood flow to the brain can become restricted. Heavy dinners before bed cause blood pressure fluctuations as the digestive system works overtime while the body tries to rest. For some seniors, this creates the perfect storm for a nighttime event. I remember a woman who told me she felt unusually tired and slightly lightheaded after a heavy meal one evening. She brushed it aside and went to bed. By morning, she was unable to lift her right arm. Her story is one of many that reveal how fragile nighttime balance can be. What happens inside the brain during sleep? The brain is a remarkable organ, constantly active even when the body is still. But with age, the blood vessels supplying the brain become more rigid. This rigidity makes it harder for the brain to adapt to changes in pressure or flow during sleep. Plaque buildup adds another layer of difficulty. If a small piece breaks loose, it may travel to a vulnerable area of the brain during the night. Breathing quality plays a huge role. If someone snores heavily or experiences pauses in breathing, oxygen levels may dip repeatedly. These dips create stress that the brain must constantly recover from. When this happens night after night, the brain becomes more vulnerable to even small disruptions. I have seen seniors who experience dozens of silent microstrokes before the major one. These microstrokes leave tiny scars in the brain. On their own, they may not cause dramatic symptoms, but over time, they accumulate. Memory becomes foggy, coordination becomes unpredictable, and emotional regulation may shift without explanation. Dangerous morning signs. After waking up. The first moments after waking up tell an important story. Seniors may try to step out of bed and realize their legs feel heavy or unsteady. Difficulty walking in the first 10 minutes can indicate that parts of the brain responsible for balance or movement struggled during the night. Slurred speech that slowly improves is another sign many people overlook. When the muscles around the mouth and tongue do not receive clear signals from the brain, speech becomes distorted. Improvement after a few minutes does not erase the risk. It simply means the brain compensated temporarily. One-sided facial drooping may appear subtle, like a slightly uneven smile, or a feeling of heaviness on one side of the face. Seniors often notice it only when brushing their teeth or washing their face. Trouble holding a cup or toothbrush can be an early sign that the brain's coordination centers were affected during sleep. If the hand shakes more than usual, or if gripping feels weaker, pay close attention. Unusual dizziness or imbalance in the morning frequently leads seniors to assume they rose too quickly, but it can indicate that the brain's balance centers struggled during the night. Improvement does not mean safety. Many silent strokes partly resolve within minutes or hours, but they still cause brain injury. These small episodes often serve as warnings of a larger event ahead, the role of sleep apnea. In nighttime stroke, sleep apnea deserves special attention because it is linked to a significant number of nighttime strokes in seniors. Up to 60% of these strokes involve untreated or undiagnosed sleep apnea. During apnea episodes, breathing stops repeatedly, sometimes hundreds of times a night. Each pause lowers oxygen levels, forcing the heart and brain to work harder. This strain creates inflammation, increases blood pressure, and destabilizes circulation. Seniors who snore loudly, wake up gasping, or feel tired despite a full night of sleep should consider getting evaluated. Addressing sleep apnea can dramatically reduce stroke risk. Practical steps to reduce nighttime stroke risk. There are many ways to protect yourself. Keeping blood pressure stable through simple evening routines like gentle stretching, reducing late-night screen time, and avoiding stressful conversations can make a difference. Heavy late-night meals should be avoided to prevent blood pressure surges during digestion. Sleeping on your side helps keep the airway open, especially for someone with sleep apnea. Hydration matters too, but the timing is important. Drink enough during the day, not just before bed. Maintaining consistent sleep schedules stabilizes circulation and supports heart health. Managing sleep apnea with proper medical support can significantly reduce nighttime risks. By the way, if this information is helpful, remember to subscribe, like, and share the Senior Health Daily channel so we can reach more seniors who need this. When to seek emergency help. Knowing when to seek help can save your life. If you notice facial drooping, even slightly, do not wait. If lifting one arm suddenly feels difficult, or if speech becomes slurred, these are clear signs to call for emergency help immediately. Time matters more than anything in stroke treatment. Even if symptoms disappear, the danger has not. Silent strokes are real, and they signal that the brain is under threat. Quick medical attention can prevent long-term damage and may even save a life. As we come to the end of this journey together, I want to bring us back to the message that has guided every moment of this conversation. Nighttime is when the body opens itself to rest, but it is also when it reveals its deepest vulnerabilities. The quiet hours are often when the earliest whispers of danger appear, and those whispers are easy to overlook. Yet awareness is one of the most powerful tools you have to protect your health. If you ever wake up feeling that something is different, even if it seems small or fleeting, I want you to trust that instinct. Those first moments after opening your eyes can tell you more about your brain and heart than you might imagine. A weak grip, a foggy mind, a slight imbalance, a strange headache, or a moment of confusion are not signs to ignore. They are gentle taps on the shoulder, reminders that your body is asking to be heard. Many of my patients have looked at me with regret in their eyes and said they wished they had paid attention sooner. They believed the signs would pass, and sometimes they did, but the underlying danger remained. Recognizing these early symptoms can lead to treatment that prevents disability, preserves independence, and in many cases, saves a life. You deserve that protection. You deserve that chance. Through all these years of caring for older adults, I've learned that the most powerful medicine often comes from within. It is made of belief, patience, gratitude, and the willingness to care for yourself with intention. Every day you choose to listen to your body is a day you choose to honor your future. Thank you for spending this time with me. Take care of your body, listen to its early whispers, and stay safe. If you found this helpful, remember to subscribe, like, and share the Senior Health Daily channel so we can continue supporting our senior community.